How long does it take for flu symptoms to appear? Imagine catching a cold and suddenly feeling chills, a sore throat, or a fever. You might wonder exactly when those symptoms will start after you've been exposed to the flu virus. The answer lies in understanding the incubation period, which is the time between exposure to the virus and the first signs of illness. For influenza, the incubation period is usually about 2 days on average. That means if you come into contact with the virus today, you can expect symptoms to show up roughly 2 days later. However, this can vary from 1 to 4 days depending on several factors. Some people might notice symptoms as early as 1 day after exposure, while others might not see signs until 4 days later. The amount of virus you are exposed to, known as the infectious dose, plays a role. A higher dose can lead to a shorter incubation period, meaning symptoms appear sooner. How the virus enters your body also matters. Inhaling droplets from coughs or sneezes can influence how quickly symptoms develop. If you have some immunity from previous infections or vaccinations, your incubation period might be shorter or your symptoms milder. Once symptoms start, they tend to appear suddenly. Common signs include a cough, sore throat, runny or stuffy nose, fever, chills, headache, muscle aches, and fatigue. Some people, especially children, may also experience gastrointestinal symptoms like vomiting or diarrhea. From a transmission perspective, people can be contagious about 1 day before they start feeling sick. They can remain contagious for up to 5 or 7 days after symptoms appear. Children and individuals with weaker immune systems might be contagious for even longer. In summary, after being exposed to the influenza virus, most people will develop symptoms within 1 to 4 days, with the typical time being around 2 days. This incubation period is crucial for understanding how the flu spreads and helps in making decisions about when to isolate or seek medical advice. If you suspect you have the flu, it is always best to consult a healthcare professional for personalized guidance and care.